Hi, everyone. Welcome back to another episode of the Gestational Diabetic. I am your host, Tracy Houston, and I'm here to inform you and empower you so that you can be a confident member of your healthcare team. As a quick medical disclaimer, none of the information in this podcast can be used to treat or diagnose any medical condition. If you feel as though you are experiencing problems with your health, please discuss them with your healthcare team. All right, guys. So November is Diabetes Awareness Month. And at the time that I'm recording this, it is November 2nd of 2020. So I thought that this episode, we would talk a little bit about diabetes and how it affects you after giving birth and if you want to have birth again, and just a little bit about the statistics and what goes on with diabetes in the United States. Diabetes is actually a worldwide issue, but most of the listeners are in the United States. And also, I'm not even sure where I can get very specific information about different countries concerning diabetes. So we're just going to talk about the United States today. You should know that diabetes has been one of the top leading causes of death for decades. Right now, it's number 7, and it's been number 7, I think, for a little over 30 plus years, something like that. But nonetheless, it has always been in the top 10 leading causes of death for the United States. Just to give you some perspective, the other leading causes of death in order are heart disease, cancer, accidents, chronic lower respiratory diseases, stroke, Alzheimer's, and then diabetes. The thing about diabetes and high blood sugar is that oftentimes the person experiencing high blood sugar has no clue until symptoms start popping up and they're like, okay, well, wait a minute, something's wrong here. Or maybe they get sent to the hospital for something and they figure out that what issue is going on in their body is actually a complication of diabetes. So these are a number of things that diabetes does contribute to: blood vessel damage, nerve damage, loss of consciousness, extreme thirst, vision disrupted like cataracts or glaucoma, or maybe just blurry vision. It's easier for you to get infections, high blood pressure, and being pregnant right now, that means that preeclampsia and hypertension, you're at higher risk for having those complications too, because you are already experiencing high blood sugar and you have gestational diabetes. Other complications, other health complications from diabetes include fatigue, digestion problems, excessive urination or protein in your urine, pancreas malfunction, ketoacidosis, dry and cracked skin, and foot issues like calluses and ulcers, and your feet getting infected from, just a basic cut. You're more prone to that cut being infected. So high blood sugar does affect so much in your body. And so if we look back at the top 10 leading causes of death, heart disease is number 1, and it's been number 1 for decades. And so heart disease develops from damage to blood vessels and nerves. And again, that's what high blood sugar contributes to. And then if we look at if we look at number 5, the number 5 leading cause of death is stroke. And high blood sugar is an established risk factor for having a stroke. And then number 6 is Alzheimer's. Alzheimer's is, they say it's plaque on the brain, and they're unofficially calling it type 3 diabetes because it affects the blood flow to your brain, and high blood sugar contributes to that as well. So 3 of the top 6 leading causes of death in the United States, high blood sugar is a contributing factor. And so I wanted to mention that because, everybody gets excited about eating whatever they want to eat after birth and not having to worry about the baby being affected by the glucose in our blood and everything like that. But there has to be some kind of attention called to the fact that it's a very real possibility that you are having high blood sugar after birth, and that it's possible that you experienced it before birth, but we can't even go back to before birth to figure that out unless you had an HbA1c test in your first trimester. And then you would have a better clue of whether you were having high blood sugar before pregnancy or not. But like I said, so with that meme going around saying that gestational diabetes isn't your fault, you can completely relinquish yourself from fault in having gestational diabetes. But the fact of the matter is, a lot of us don't know what state our health was in before that. Because just because you looked healthy and you felt healthy doesn't necessarily mean that you were as healthy as you think. Because again, high blood sugar, you don't really feel it or know it, or your body doesn't really tell you in an obvious way until it's a very obvious problem, like a stroke or your vision getting blurred. Even then, I mean, I think about sometimes I've had blurry vision and I just rubbed my eyes. I don't know if I was experiencing high blood sugar back then. So as we continue on in our lives after birth, we want to make sure that we're taking great care of ourselves, because listen to these statistics. In the United States, 1 in 10 people have diabetes. And that is kind of a guesstimation, because they are including people that they think are undiagnosed as well. So 10.5% of the United States population is said to have diabetes, whether it's diagnosed or undiagnosed. But 34 million of them are diagnosed, and they estimate that around 7 million people are undiagnosed but actually do have diabetes. And then 1 in 3 people are pre-diabetic. So that's 34.5%. And this information is from the CDC. 34.5% of the United States population is pre-diabetic. That's 88 million people. And you know what, I should have started off with this, but I'm not giving you this information to scare you or, try to make you like become a stickler for what you eat or whatever like that. I'm giving you this information because we can't do something about a problem unless we're informed. So back to these statistics, the CDC did note that the instance of diabetes between the years of 2008 and 2018 has decreased among adults. That's great, right? Unfortunately, the instance of diabetes in children has increased, right? So when we look at these statistics of people who are diagnosed and undiagnosed and pre-diabetic and all that, they said that 15% were smokers. Smoking is terrible for diabetes. Smoking is like a catalyst for diabetes. And it's such a big deal. I plan to have an entire podcast episode about that. And I know exactly who to come in for that interview, but I just have to get in touch with them. So that's a different topic for a different day. But so 15% of them were smokers. 38% of them were physically inactive, had a pretty much sedentary lifestyle. And 89% of them were overweight. If I'm sure you know that diabetes, one of the risk factors for getting diabetes is being overweight, having a high BMI, which stands for body mass index. And I want you to know that, if you look at yourself in the mirror and you think that you're slender enough, that doesn't mean that you don't have a high BMI or that you're not overweight. Because I remember when I first learned about what BMI was, the person who taught me technically was overweight according to his BMI. But looking at him, he was really toned. And in fact, he was an Air Force I was in the Air Force at that time. He was an Air Force instructor. And yes, he was really toned. He ran all the time. And you wouldn't look at him and think that he was any bit overweight or that he would have a high BMI. But according to the calculations, he did. So it's better to actually run the numbers or go get tested than to just look and guess. If we just look and guess, there's a pretty good chance we could be wrong, right? But if we actually go and get tested or run the numbers or whatever the situation may be and get the actual data, then we can have a solid answer and make better choices with that information. Okay, so I talked about the instance of diabetes being increased in youth, and that was in both type 1 and type 2 diabetes. But we're not here to talk about the kids. We're here to talk about mama and how mama moves on after birth. So after pregnancy, I would just say, be mindful of what you're eating. Hopefully you've gained some kind of positive eating habits through this period, and maybe you're not even craving the carbs like you used to, or the sugar like you used to. Yes, it's not sugar that causes diabetes. Yes, I get that totally. But there are a lot of hidden carbs in our food these days, especially, my goodness, the review that I just did on Chili's, the restaurant. There's so many hidden carbs in their menu. It's crazy. It's nuts, guys. And so, just be mindful of your intake and your overall lifestyle, because it's not just carbs that causes diabetes. It's not just sugar. It's your overall lifestyle. So try to be active. I'm sure when your baby starts crawling around and walking, you're going to be active. But overall, the fact is that you did or do have gestational diabetes, and so you want to take better care of yourself, especially if you want to have another baby. Because listen to this. There were some researchers that surveyed data over a span of years, and it included 8,500 subjects. And so what they were looking at was how taking care of yourself before conceiving affects your outcomes during pregnancy. And this is what they found. So if you take good care of yourself in your preconception period, it reduces the chances of a congenital malformation by 71%. If you don't want to, if you don't know what a congenital malformation is, that is a major malformation that normally happens in the first trimester. It's highest in the first trimester, and then it could happen in the second trimester, but the chances are reduced at that time. But it's something like cerebral palsy, spina bifida, cleft lip, cystic fibrosis, heart conditions, Down syndrome, stuff like that. And high blood sugar is a direct contributor to those malformations. And in fact, the instance of miscarrying in the first and second trimester for congenital malformations is higher because of that. So that's why high blood sugar is so important. It's not just in the third or late second trimester when it matters. It matters throughout the entire period, for your baby at least, and for you it matters, period. So back to the researchers and their data, they also said that if you take good care of yourself in the preconception period, it reduces your risk for preterm delivery by 15%, perinatal death by 54%, NICU stays for the baby by 25%, the instance of small for gestational age by 48%. Those are some pretty big numbers. Now, it wasn't like a hard fact, like for sure 25% of NICU stays will be avoided if you take good care of yourself. There are a lot of factors that go into this kind of data and research, but it's still something to consider. And I want to note that they said that the instance for miscarrying, C-section, a large baby, shoulder dystocia, and hypoglycemia, they had how well you take care of yourself in the preconception period had little to no effect on those in those cases. Okay, guys, so I know that was a lot of numbers and a lot of statistics, but basically I'm saying all this to say, take good care of yourself. Be mindful of your nutrition, especially if you want to have another baby. No, having gestational diabetes isn't your fault, but consider your lifestyle before you had it. Consider what you were eating. What were your eating habits? And then apply what you've learned in this time. because you are at higher risk for developing type 2 diabetes after having gestational diabetes. In fact, the statistic is that up to 70% of women with gestational diabetes will go on to develop type 2 diabetes within 5 years after birth. And then after that, the statistic drops down, but there's still somewhat of a chance, so to speak, until the 10-year mark. And then after the 10-year mark, it drops down very drastically. And everyone talks about type 2 diabetes as if that's the only thing that can happen, but type 1 diabetes is also a possibility. There are moms that have gone on to develop type 1 diabetes after having gestational diabetes. And after listening to Miranda in episode 9 about postpartum and how our bodies handle the postpartum period, we understand why. Because I think she said it was some 30 something percent of women end up developing, or no, excuse me, it was women in the first year of postpartum are at 30% chance higher of developing an autoimmune disease. And that's what type 1 diabetes is. It's an autoimmune disease. So if you get a chance, go ahead and listen to episode 9 with Miranda. It's about deeply healing your body in the postpartum period. It's an episode that every mom should listen to, even if you're years after your birth. Everything that I mentioned in the episode, all the research will be linked in the show notes. That's all I have for you today, guys. I'll talk to you later.